to quick fix for the Quadratus Lumborum muscle. Most muscles are named after their shape, location, or function, and in this case, this muscle is named after the shape. It's quadrangular, and the location. It's in the lumbar region. So this muscle connects the lower part of your ribs, the 12th rib, the lower part of your lumbar spine from L1 to L5, and the top of the pelvis. So essentially this region here. The space that we have between the pelvis and the ribs are going to be different for every single one of us. So in order to find this muscle, all you have to do is take your hands to your waist and you'll feel it's kind of squishy. As you push down, you'll feel that you're hitting the top of your pelvis. And right at that top portion, if you move up just a tiny bit, you'll feel, notice my hands are wider, they're not close to the spine, and you'll feel it might be a little tender there. So make sure that you're between your rib cage and your pelvis, and this is the Quadratus Lumborum region where we're gonna roll out. Now this muscle is responsible for laterally flexing the spine to the same side, lifting the pelvis, drawing the 12th rib down, and stabilizing the lower back. So you can imagine, everyday functions of sitting, standing, and walking, this muscle is very active. And this muscle commonly gets pain or tension from overuse or underuse, just like any muscle in the body. Keep in mind that if you have any pre-existing conditions in the lower back, or if you are having a lot of pain, it's really inflamed, you may want to wait to roll out on this muscle, and you may want to also consult with a doctor. Otherwise, this is a really great way to bring some release to this muscle and the lower back, awareness, and hopefully to get those muscles to relax. Before we get to releasing the muscle, I like to do a little test and retest so that you can see how you feel before you roll out and then see how you feel after you roll out. So come into a seated position with your legs crossed, hands on the floor beside you. Crawl your right fingertips out to the side, bend your right elbow so you relax the shoulder, and reach your left arm either overhead or behind your head. Now try to keep your left sit bone rooted to the floor and notice how you feel here. The range of motion, so how far you're going, and if you feel any resistance or tension. And then come back up and switch to the other side. Again, hand can go behind your head, that's less strain on the arm, or you can reach the arm overhead. Again, notice the range of motion, how deep you're going, and any resistance you encounter here. And then slowly come back up. So all you need for this class is a set of therapy balls. You're actually going to take them out of that tote bag, if you have one. And again, in order to find this muscle, you're going to find your rib cage and pelvis, and that space between right at your waist. If you push down, you'll be hitting the top of your pelvis. If you push up, you'll be hitting the bottom of your ribs. And right in between where it's squishy here on the back sides, or more towards the sides, you'll feel the muscle. So you're gonna take your therapy balls to that spot on both sides and lie down on your back. Now, when you lie down, I highly recommend planting your feet to the floor. It's just gonna bring more concentrated weight on the area that we're rolling out. And at first, it may not feel like a whole lot, right? Especially since we're not centering the ball all the way under the middle of your back. It's more on the sides of your back. But what you can do to start is just place your hands on your belly and the lower part of your ribs and take deep breaths here. And you'll feel your back muscles expanding down and contracting back up. And that's the first part, right? Just bringing awareness to those connective tissues that surround the muscle, that interweave through the muscle, but also the muscle group itself to get it to expand and contract, right? Because that's what every muscle is meant to do. And then from here, if you would like to add on more, you can gently windshield wiper the legs from side to side, just applying a little bit of pressure on each side. You can make this a bit more dynamic, so moving the legs as you breathe in and out, or you can hold on one side for maybe an extra cycle of breath or two. And then you can move to the other side. And you can even hug one knee to your chest, holding either around the shin bone or behind the hamstrings, and using this passive stretch to guide you into a deeper compression into the lower back on that right-hand side. Breathe into the right side. You can even rock your body weight a bit more to that right-hand side. And then switch sides. Holding either around the shin bone of your left leg or behind the hamstrings. Again, you can apply some pressure by leaning a bit more to the left-hand side. Take 2 more breaths. And then you can hug both knees to your chest. You can just hold in a static position, or you can move a little bit from side to side. And then one at a time, plant your feet to the ground. Lift your hips up, move the therapy balls to the side, and just come back to resting here, hands on your belly and lower ribs, feet planted. Just take a deep breath in, feel your back expand. And exhale, feel your back muscles contracting in and up. Just by adding that sense of compression, it may feel easier to breathe, a bit more expansive. So now we're going to come back up and retest that range of motion, getting the spine to laterally flex on either side. So crawl your right fingertips out to the side, bend your right elbow, and reach your left arm overhead. Notice the range of motion that you have here. You can always take your hand behind your head, like we did at the beginning, but try to keep both sit bones to the ground. And you may find that you can move a bit further and with more ease. And then come back up and switch to the other side. Bending through your left elbow. You can reach the right arm overhead, or you can take your right hand behind your head. But again, notice a difference in the amount of range that you have. And then slowly come back up to center. So that's a really quick way to bring some awareness and release to the Quadratus Lumborum muscle, to hopefully bring some release to the lower back region. If you have a little bit more time and you know you want to focus on other areas of the body, go ahead and check out some of the other quick fix videos and see if you feel a little bit better, have more range of motion, and more control in the body.